Hi, and welcome to the Heart of Advocacy Podcast, where we help you navigate the healthcare system with confidence. I'm Dr. Sara Lemert, physician associate and independent patient advocate. Today, we're diving deep into coronary artery bypass surgery. If you or a loved one is facing this surgery, it's perfectly normal to feel anxious, overwhelmed, and maybe even confused by all the information. My goal today is to walk you through this complex procedure in detail, breaking down each step so that you feel better prepared and more at ease. If you need more information or would like an advocate to walk you through your journey, I would love to chat with you. Schedule a free consult by calling 406-404-9477 or visit www.platinumpatientadvocates.com. Now, let's start by understanding exactly what coronary artery bypass surgery is. Coronary artery bypass surgery, often abbreviated as CABG or CABG, is a procedure designed to improve blood flow to the heart muscles. Over time, the coronary arteries, the blood vessels that supply the heart, can become blocked by plaque buildup. This plaque is made up of cholesterol, fat, and other substances in the blood. When this happens, it's like a traffic jam in your body's highway system. Blood flow slows down or stops, depriving your heart muscle of oxygen, which can lead to chest pain, fatigue, or even a heart attack. The bypass surgery acts like a detour, allowing blood to flow around the blockage. In coronary artery bypass surgery, surgeons take a healthy blood vessel from another part of your body, often the leg, arm, or chest, and attach it to the coronary artery above and below the blockage, creating a new pathway for blood flow. If more than one artery is blocked, the surgeon may create multiple bypasses during the same surgery. This procedure is often recommended when blockages are too severe to be treated with medication, lifestyle changes, or less invasive procedures like stenting. For many patients, bypass surgery significantly improves quality of life, alleviating symptoms like chest pain and improving exercise capacity. It is one of the most common major surgeries worldwide with a high success rate, especially when performed by experienced surgical teams. So why would someone need this surgery? The need for coronary artery bypass surgery usually arises after a diagnosis of coronary artery disease, also known as CAD, which is the most common form of heart disease. Patients often first notice symptoms like angina, which is a chest pain or discomfort that happens when your heart isn't getting enough blood. It can feel like pressure, squeezing, or tightness in the chest, and sometimes it radiates to the arm, neck, or jaw. You may experience shortness of breath. You may feel winded even during simple activities like walking or climbing stairs. And fatigue, meaning that even routine tasks can leave you feeling unusually tired. If these symptoms become severe or don't respond well to other treatments, doctors may recommend bypass surgery. The decision to undergo the surgery isn't made lightly. It involves considering the severity of blockages, your overall health, and other risk factors like diabetes, high blood pressure, or kidney disease. It is important to have an open and thorough discussion with your cardiologist to understand why this surgery is necessary and how it can benefit your heart health in the long run. Before moving forward, let's take a moment to break down some of the terminology you might hear during your consultations. Firstly, graft. This is the healthy blood vessel that will be used to create the detour around the blocked arteries. For instance, the saphenous vein from the leg, the radial artery from the arm, or the internal mammary artery from the chest might be used. Each of these has different benefits depending on your condition and the location of the blockages. You might hear the terms on-pump versus off-pump surgery. Some surgeries use a cardiopulmonary bypass machine, which takes over the function of the heart and lungs during the surgery, keeping blood circulating while the surgeon operates on a still heart. This is called an on-pump surgery. In off-pump surgery, the heart continues to beat while the surgeon performs the bypass. Anastomosis is a term that refers to the connection made between the graft and the coronary artery. It's essentially where the detour is sewn into place. you may hear the term myocardial ischemia. This means reduced blood flow to the heart muscle, often the underlying reason for bypass surgery. I know all this terminology can be a lot to digest, but understanding these terms will help you feel more informed and less intimidated by medical conversations. Don't hesitate to ask your doctors to clarify any of these terms. They're there to help you understand. Now, let's talk about what the preparation phase looks like. It's not just about showing up on the day of surgery. There's a lot that goes into getting ready, both physically and mentally. First, consultations. You'll likely have multiple pre-op appointments with various specialists. Your cardiac surgeon will walk you through the procedure in detail, explaining the risks and expected outcomes. You may also meet with an anesthesiologist to review your medical history, allergies, and previous experience with anesthesia. Other specialists, like a cardiologist or nutritionist, may also be involved. Then there's diagnostic testing. Expect to undergo a series of tests, which might include blood tests to check for overall health, kidney function, and clotting ability, an EKG or electrocardiogram, which is to measure your heart's electrical activity. Also, an echocardiogram, which is an ultrasound of your heart that provides information about its structure and function. Sometimes you'll need a cardiac catheterization, which is used to get a clearer picture of blockages. You'll need to undergo lifestyle changes. In the weeks leading up to surgery, you may be advised to stop smoking, reduce alcohol intake, and adopt a heart-healthy diet. You may also be asked to engage in light exercise like walking. These changes not only prepare your body for surgery, but also set you up for better recovery outcomes. Some medications, like blood thinners, may need to be stopped a few days before surgery. Make sure you have clear instructions from your doctor about which medications to take and which ones to discontinue prior to surgery. Then there's packing for the hospital. Make sure you bring comfortable clothing, toiletries, your medications, and perhaps a book or music to pass the time during recovery. It's normal to feel anxious during this pre-op phase. Take comfort in knowing that each preparation step is designed to make your surgery feel safer and your recovery smoother. Recovery from bypass surgery isn't just about healing your chest incision. It's about making lifestyle changes that promote long-term heart health. This includes routine follow-ups. You'll have regular checkups to monitor your heart's progress and to adjust medications. These appointments are critical to ensure that your heart is healing well and that there are no signs of new blockages or complications. You'll have cardiac rehab. You most likely will be referred to a cardiac rehab program. This is a structured exercise and education program designed to improve your heart health, build endurance, and reduce the risk of future heart issues. You'll need to monitor symptoms. Make sure you keep a log of any symptoms you notice, whether they're physical, like chest pain and swelling, or emotional, like anxiety or depression. Open communication with your health team is crucial. Coronary artery bypass surgery is a major step, but it's often the best option to restore your heart's function and improve your quality of life. Remember, you're not alone in this process. Your healthcare team, family, and even health advocates like myself are here to support you every step of the way. Take one day at a time, ask plenty of questions, and give yourself grace as you navigate this journey. And most importantly, don't forget to celebrate the small victories along the way. Each step forward is a sign of progress. Thank you for listening to today's episode of the Heart of Advocacy Podcast. If you found this information helpful, please share it with someone who might need it. Make sure you download your free cardiac surgery guide at www.platinumpatientadvocates.com. Stay well, and I'll see you in the next episode.